What happens if a cat with FIV bites you? Feline immunodeficiency virus, FIV, is a condition that affects cats in a way similar to how HIV affects humans. It weakens the immune system, making the cat more vulnerable to infections and diseases. If you have been bitten by a cat with FIV, you might be concerned about the risks involved. This article explores what happens when an FIV-positive cat bites a human, potential health risks, and how to properly handle a bite. Point 1. Can humans get FIV from a cat bite? No, humans cannot contract FIV from a cat bite. FIV is a species-specific virus, meaning it only affects cats and cannot be transmitted to humans, dogs, or other animals. Unlike Rabies, which is zoonotic, can spread between animals and humans, FIV is strictly a feline disease. While FIV itself is not a threat to humans, a bite from any cat, whether FIV positive or not, can pose other health risks due to bacteria present in the cat's mouth. 2. Potential risks of a cat bite. Even though FIV is not contagious to humans, cat bites can still be dangerous for the following reasons. A. Bacterial infections. Cats' mouths contain bacteria such as Pasteurella multocida, which can cause infections if introduced into human tissue. A deep bite can lead to cellulitis, an infection that spreads rapidly and causes pain, swelling, and redness. B. Cat scratch disease, CSD. Some cats carry the bacterium Bartonella henselae, which can cause cat scratch disease, CSD. If an infected cat bites or scratches you, you may develop symptoms such as fever, swollen lymph nodes, and fatigue. C. Risk of tetanus. If the cat bite is deep, it can introduce Clostridium tetani bacteria into the wound, increasing the risk of tetanus, which affects the nervous system. If you haven't had a tetanus shot in the last 5 years, you may need a booster. D. Rabies concerns. Although an FIV-positive cat is not necessarily a rabies carrier, any unknown or feral cat bite should be treated with caution. If the cat is unvaccinated for rabies, seek medical attention immediately. 3. What to do if a cat with FIV bites you. If you are bitten by a cat, follow these steps to reduce the risk of infection. Step 1. Clean the wound immediately. Wash the bite thoroughly with warm water and soak for at least 5 minutes. Use an antiseptic solution like hydrogen peroxide or iodine to disinfect the area. Step 2. Apply antibiotic ointment. Apply an antibiotic ointment, such as Neosporin, to prevent bacterial infection. Cover the wound with a clean bandage. Step 3. Monitor for signs of infection. Look for redness, swelling, warmth, pus, or increasing pain around the bite. If any of these symptoms appear, seek medical attention immediately. Step 4. Seek medical help if necessary. If the bite is deep, consult a doctor for possible antibiotics. If you haven't had a tetanus shot in the last 5 years, you may need a booster. If the cat is unknown or unvaccinated, consult a doctor about rabies prevention measures. 4. Preventing cat bites. To reduce the risk of being bitten by an FIV-positive cat, avoid rough play with cats, especially those that are easily agitated. Learn to recognize warning signs of aggression, such as hissing, growling, or an arched back. If handling an unfamiliar or aggressive cat, wear protective gloves. Conclusion. While FIV is not transmissible to humans, a bite from any cat, whether FIV positive or not, can introduce harmful bacteria and cause infections. If bitten, clean the wound immediately, apply antiseptic, and monitor for signs of infection. Seek medical attention for deep bites, swelling, or any unusual symptoms. By handling cats carefully and understanding the risks, you can prevent potential complications from cat bites.